So I'm at the end of my tether. I don't know what to do. I'm having issues with my GP surgery and my prescriptions. They've completely messed them up. And now they're refusing to issue them. So I don't know how I'm going to get my medications. I haven't had my meds for almost 2 weeks now because of this shit. And excuse my language, but I'm really stressed out. I'm feeling really ill. Basically, a month or more ago, almost 2 months, I think. I can't remember exactly. My brain ain't working correct, so I can't remember dates and time frames and that at the moment, clearly. So, but a couple of months ago, I had some new heart medications added to my prescriptions by the hospital, by my heart doctors. And I know when new medications are added, sometimes there can be a little bit of hiccup due to communication from the hospital, between the hospital and the GP. I understand that there can be a little bit of a hiccup there, right? I understand that, and usually that's quite easy to solve. I just see the GP and say, this is what they've done. They check the system, like, yep, okay, we see the meds you should be on, and they sort it for me, which isn't a problem. And that's what happened. But since then, a couple of times, I've got a few different prescriptions, and they've left a few medications off. So I've had to go see them and say, look, you've forgotten this one, you've forgotten that one. And they said, oh, right, we'll sort that out for you. Come back tomorrow and pick it up and whatever. The most recent prescription, John took in a couple of days ago to the GP and then he went back today to pick it up and take it to the pharmacy. Now, the GPs gave him the totally wrong stuff. They gave him 2 slips here, which are repeat slips. These white ones are the ones you got to give to the GP, right? And then the GP, you come back in a few days and pick up one of these green ones, some of the green ones. And you give these green ones to the pharmacist. The pharmacist gives you your pills and gives you more of these white ones, which then you start the process again, hand in the white one to the GP. Simple, right? But the GP gave John these, which are old ones. They're out of date. They're old ones, and they don't even have the correct all the correct medications on. And she gave him this green one, which only has my sleeping pills on it, and that's it. And when John said to her, look, this appears to be the wrong prescription, and she said, oh, no, it's the right one. He said, yes, but we should have a green one to come with these white ones. It should be all these medications on this one, but it should be a new one with one of these green slips. And she said, oh no, that's not how we do it anymore. We've changed our system. We now take the green ones and you have to take these white ones to the pharmacist. And he said, that doesn't seem right. And she said, oh no, that's how we do it now. So John was like, okay, fair enough. So he went downstairs to the pharmacy and showed the pharmacist these prescriptions and said, there you go. And the pharmacist said, sorry, we can't take those. These are out of date and we can't take them, they're the bits that the GP has to take. And he said the green one, I think they could take the green one, or for some reason they couldn't take the green one either. So John was like, right, okay. So he came back here to find out from me exactly what medications it was I needed. I told him. He then rang up the GP surgery and spoke to the receptionist again to try and sort it out. And she said, oh, right, I see what's happened. They've given you the wrong part of the prescription. Come back down here now and I'll sort this out for you. So off John goes, plods off to the GP surgery to sort this out. And he shows them these bits of paper and says, you know, you've given me all the wrong bits here. These are the wrong ones. You know, and he tried to explain to her, and she said, oh, I see what's wrong. You haven't ticked the little boxes, because there are little boxes on here. If I can fold it over a little bit, because I don't want to show you my... There's little boxes, tick boxes there. You're supposed to tick those, apparently. It's upside down, I think. Or backwards. But yeah, you're meant to tick those little boxes to show which medications you need. Okay, fair enough. But they told me that before. And I said, right, okay. So I ticked the boxes one day before. And then they told me, no, you're not supposed to tick the boxes. So I'm confused. I'm now like, do I tick the boxes or don't I? Because I keep being told different. Every time I tick the boxes, they told me I shouldn't tick the boxes. When I don't tick the boxes, they tell me I should. So I'm very confused about that now. And basically, they wouldn't sort it out. They said that they can't take these prescriptions, they're not due and they're out of date. And John said, but they are due. She's due her medication. She has none left. She's been without heart meds for almost 2 weeks now. She's not well at all. You know, and they said, oh, well, there's not much we can do. You'll have to wait until they're due again. And he's like, but they are due. These, you've given me back the wrong bits. What have you done with the prescription I handed in like 2 days ago? And she said, that is it. And he said, no, it's not. You've given me the complete wrong thing. These are old prescriptions, which I don't know why they have these. I don't know why they had these old ones on file. You know, because, let's see, there's a date on this. Next due date, 30th of October 2018. And not all the right meds are on there. This one, which this says it's a new course, which this is one that I took up there and said, look, this is the wrong prescription, not all the right meds are on there. So they sorted me out a new one with all the right meds. So I don't know why they've kept this one on file. They've probably kept it on file deliberately to pull this shit, you know. This one has all but one med on it. It has all the meds I need apart from one, which is my sleeping pills. 1st of October 2018. Apparently. Next issue date 27th of November 2018. See, so I'm really confused. They've like completely confused me. So I don't know what to do now. I've got no heart meds, no pain meds. the only meds I have a few candesartan left and whatnot, which probably will last me a couple of days, and a few sleeping pills. That's it, you know. And I've been reluctant to take my candesartan because I'm thinking I'm probably gonna need it, you know, because at the moment I'm feeling really ill. I've been getting dizziness, nausea, palpitations, erratic heartbeats, chest pains, all that sort of thing, because I've not had my heart meds, you know. I have a very weak heart and aorta due to the Marfan syndrome. I've had heart surgery to basically mend my aorta because I had an aortic aneurysm. I've got dodgy valves that leak. My connective tissue in my heart is basically buggered. So if my blood pumps through my heart too fast, it will basically, the easiest way to say it is shake my heart apart. It will split my aorta and make holes in my aorta, you know. If my heartbeat is too erratic, if it beats too heavy and too fast, you know, that with connective tissue problems, you can imagine what that would do. It causes problems with the valves, everything, you know. So I've got to keep my blood pressure and heart rate as low as humanly possible, which is what the heart meds are for. That's what they do. They help to keep my blood pressure and my heart rate low, you know. But because I've not got them now, dread to think my aorta's probably going to be like Swiss cheese by the time I get all this sorted out, you know. I feel really ill. I don't know what to do. I don't know how I'm going to get my heart meds. I might have to go tomorrow up there and try and sort it out, speak to them and find out, you know. But to be honest, I don't want to, because the receptionists up there are so nasty. I mean, when I go up there on my own to deal with this, they treat me like a dumb child, because they know I have learning difficulties and I struggle to speak to strangers and things, you know, with my anxiety and everything. They play on that, you know, and they talk to me like I'm dumb and stupid, seriously. And it might be, people might say, oh, that's probably just the fact that you're stressed out at the time and that's the way they come across to you. They're probably not coming across that way. But no, they are coming across that way. Seriously, they do it to other patients. I've stood in the queue up there waiting to be seen, and I've seen them treat other patients this way. And I've had friends and family come with me, and they've said to me afterwards, the way that receptionist spoke to you was horrible. They shouldn't speak to you like that. And I said, yeah, I know, but if I complain, this is the shit they pull. They mess up my prescriptions. This is how Western Lane GP surgery treats their most vulnerable patients. They treat them like a bit of shit. They're risking my life. They've risked my life several times. I nearly died because of that GP surgery. You know, I went up years ago. I went up there when I first moved to Western. I went up there and I signed up at that doctor's and I said, look, I have Marfan syndrome. It causes problems with my heart. Since I was born, I've had a dilated aorta. It needs a regular check. I need regular yearly heart checkups at the hospital. Can you refer me, please? And they said, no, we can't refer you. And I said, well, why? And they said, well, are you having chest pains? I said, no. And they said, well, you're not having chest pains, you're quite young. I've never heard of this Marfan syndrome. So, you know, we can't refer you, which is a load of bollocks, because it's not up to the GP to decide whether you need referring. If you ask to be referred, that by law, they've got to refer you. They're not allowed to tell you no, because it is up to the specialist that they refer you to give you an evaluation to decide whether you need their help or not. It's not up to the GP. The GP is not trained for that. So if you ask to be referred, the GP by law has to refer you. You know, and they didn't refer me, and I was asking for a few years to be referred. And then one day there was a doctor up there that was volunteering or something. He was covering someone because they were out on holiday or something. And he's training to be a heart doctor at Southampton General. And I had seen him previously with my sister. And I think it was I saw him for some reason. I can't remember why. I think it was with my sister or it was with someone. And he said, yeah, you do need referring. And he referred me. I went up to the hospital, got checked up, and they were like, we need to rush you in for emergency surgery. Your aorta is about to dissect. Basically, you know, you have an aneurysm that is about to explode. Split your aorta from fucking here to here and whatever, you know, and if that had happened, I would have been dead, you know. So because of that surgery, I nearly died. I was this close to dying. And a lot of people have said to me, that is crazy, why haven't you changed GPs already? I haven't changed GPs already. One, because the GPs in this area are all run under the same people. It is the same organisation. I'm not sure what they call it really. It's like one big group that runs Western and Woolston doctors' surgeries. So I will get the same treatment if I go to Woolston. Right, and if I go further afield, like maybe to Southampton City Centre or to Shirley or something like that to see a doctor there, they will tell me I'm out of some kind of catchment area and they can't take me on as a patient, that I need to go to Western or Woolston. So basically, I'm stuck with this GP, with these GPs, you know. And I don't know what to do now about my heart meds. I'm trying to stay calm. I'm trying to keep my blood pressure low. I'm trying to keep my heart rate low. I'm trying not to freak out. John has already freaked out. He basically, at the end, at the GP surgery, because they kept messing him around, they wouldn't sort out my prescription. His mental health was kicking off, so he kind of kicked off a bit and shouted and sweared at him a bit, which, to be honest, I can't blame him, really. You know, he sort of told them to go fuck themselves and whatever, you know. So I can't blame him for that, to be honest, because he said it was either that or I punched the woman, you know. And to be honest, I'd rather he swear at her than punch her, you know. So, and apparently we're banned from that surgery now. So I don't know how I'm going to get my meds now. But, you know, I'm going to go up there tomorrow, see if I can sort this out. If I can't, then I don't know, I might have to ring my heart doctor or pop up to A&E tomorrow and speak to someone there, because I'm not feeling well at all. I'm getting chest pains and everything, so yeah, probably going to be in hospital by tomorrow in the heart ward. But yeah, I don't know if you can see, it's getting quite dark in here now. It's quite late, but I'm going quite red. I'm quite hot. This is to do with the blood pressure. When my blood pressure gets too high and my heart rate gets too high, I'll get very red around my cheeks and my neck and my chest and everything, and very warm. So yeah, I think I'm just going to go and try and relax, have a cup of tea. Which is good because John bought me some Assam tea earlier, which is one of my favourite teas. So I'm going to probably have a cup of that and try and watch some Netflix and then have an early night or something, and then get up tomorrow and try and sort all this mess out. But yeah, this is how Western Lane treats its most vulnerable patients. And I've made complaints, several complaints to the CQC. What was it? Something like that, the Quality Care Commission, something like that. I've made several complaints to them about this surgery, and I just seem to get ignored. So, you know, I've given up with that. I'm probably going to go to the newspaper as well. Go to the newspaper, see if I can get them on board. But I'm getting sick of this now, and I think it's time to make a stand. So yeah, but I'm going to go now and stop fucking ranting about this. Thanks for watching. I will keep you updated on what's going on. See you all later. Bye bye.